Welcome to MOCEAN's European office at our headquarters of Optención in Athens. We are honored today to introduce you the first video user's guide for the MOCEAN high-definition widefield spectral domain SLO OCT with VASCAN optical microangiography, the new market changer. In cooperation with Dr. Michalis Arvanitis, we are here to show you all the new features, the new specifications, and how to operate the OCT for achieving high-quality images and high-quality results for your diagnosis. Welcome to MOCEAN's European office. Welcome to Optención.
Welcome. My name is Dr. Michalis Arvanitis, surgeon ophthalmologist, owner of Eye Focus Center, and scientific advisor of Optención. Today, we will show you the first video user guide of MOCEAN 4000 OCT with VASCAN optical microangiography. Our purpose is to show you by very simple steps all you need to know from A to Z in order to acquire high-resolution images and obtain a very accurate diagnosis for your patient. Step 1. Now we will show you how you can create a new patient record. If you are a single user, then you press the Go button and you enter the program. In case you have many users, you can select from the OCT username and the password of this user. Again, press the Go button and enter the program. Now you are in the main screen. Here, you can add the information of a new patient. You press the New Patient button, and there is this dialog box. You enter the first name of the patient, the last name of the patient, the gender, the race, and the date of birth. Once you're ready, you click on the Save and Exit button. This will save the patient's data and you are ready to go on with scanning the patient. You press the New Scan button. You can see here there is a new panel. You can select from different scans: the macular HD line, the macular 6 radial line, the macular cube, and the macular cross beam. There is also the glaucoma panel, the glaucoma optic disc, the glaucoma macular cube, which is practically the ganglion cells, and you can move on to the anterior segment scans, which are anterior HD line, the corneal 6 radial line, and finally the angle-to-angle scan. For the OCTA scans, you can select the OCT macular angiography, and you can select the OCT optical disc angiography. At the bottom of the panel, you can select between the 6mm scan width or 11mm scan width. You can also select on deep choroidal imaging, on or off. And finally, you can activate the eye tracking, on or off, in case you have a patient which is not cooperating very well, or if you want to have follow-up images. Once we have registered and saved the patient record, we can proceed with our first scan. This will be the macula HD line. Once you have selected the specific patient, it will be highlighted in the blue box. You can have your first scan by pressing the new scan image. Here you can see two different images. At your left there is the SLO image. At your right it will appear the OCT image. You can select among 6 mm width or 12 mm width. You can activate the deep choroidal imaging in case you want to have a better visualization of the choroidal. Finally, you can activate the eye tracking if you have a very difficult patient which moves, for example, or for better results if you want to follow up a patient in order to have a better repeatability and better accuracy. At the SLO image, at any time, you can rotate the actual scan line, or even you can move the whole line at any place you want. This will be very, very useful in case you have a pathology in a specific area which is not centered very well. Finally, if you double-click on the SLO image, it will appear some more settings like brightness, contrast, and gamma. Of course, you can select the auto feature and let the OCT decide which are the best features for this patient. You can do the same thing with double-clicking the mouse at the OCT image. And now we are ready to take our first scan with the patient. Once we have set up our patient, we can acquire our first macular HD line. We first find the reflection of the retina and then we move forward in order to enter the eye. Once we have a good SLO image and a good OCT image, we press the button of the joystick in order to acquire the image. The OCT has acquired 100 scans, so we press the Analyze button in order to pick the best one. Here you see again two photos, one on the left, which you see the SLO image, and one on the right, and you see here the OCT image. If you double-click on the SLO image, you can have a better visualization, and if you go at the top, you can select the contrast, brightness, or even you can export the image. If you press back, you go to the previous screen. You can do the same with the image of the OCT. You can double-click on the image and have a better visualization, and if you go on the top of the screen, you can change the contrast in order to have and see what you want, or even the brightness. You can always select the max scope, which automatically chooses the best settings for you. You can also change from black and white to yellow and green, and go back to black and white again. You can also export this image, or even go back to the main panel. Now you can go on with the comments. At the comments, you can use the description panel, and all the information you use here will be visible to your patient and to the printing exam. More, you can use the diagnosis panel or the memo panel. Here, you can enter information which will be kept internally and which you can use only by yourself. If you print the photo, then you have the print preview, the print exam, and this is how it looks like when you want to print it. You can measure any distance you want. Here you see a lot of tools. For example, if you press the straight line tool, you can select a distance and the OCT will automatically measure this for you. You can also see the measurement here. you can perform a lot of other features at your convenience. It will ask you if you want to save the changes, for example, this measurement. You can select yes or no. Finally, you can use DICOM if you want to send these results. You can use the history if you want to compare with previous exams of the patient, or you can use the follow-up button if you want to follow up the patient for better results. And finally, this is how you exit from this scanning. Now we will take our second scan, which is the macular 6 radial line. Again, we follow the same procedure in order to enter the eye and focus the OCT. We ask the patient to blink once or twice again, and then we press the joystick button in order to acquire these 100 images. You see here the images, and once you press the Analyze button, you have the best image of these 100 images. Again, you see the SLO image and the OCT image. You can select which line you want to see, and of course you can click on any image to see the corresponding image. At the bottom, you see at your left the absolute numbers of the pachymetry of the retina from ILM to RPE. At the second map, you see the same information in a pseudochromatic map. Of course, at the third one, you can see how this is comparing with the normative databases and if your patient is within the normal limits or not. We go on with the actual pachymetry of the ganglion cells complex. And of course, at the next one, at the next image, you can see it in a pseudochromatic map. And finally, you can see if your patient's ganglion cells are within the normal limits or not. As we have said in previous scans, you can also use the comments the same way, and if you press the print button, you can see the print layout, which is the one you see here. From here, you can print the exam. Of course, you can also use the measure, as we said before, the same way, the DICOM, the edit, the history, and the follow-up of the patient. Finally, if you want to move back, you press the exit button. So we have finished with the macular 6 radial scans, and now we move to the macular cube. Again, we have to focus properly and enter the eye in order to acquire a very good quality image. Once we are almost ready, we will ask the patient to blink once or twice. And once we have a very good image, we press the joystick button in order to acquire the exam. As we can see here, there are no interruptions, which means that the patient hasn't blinked, hasn't moved the eye. Here we have horizontal 256 scans and the same at vertical level. So we are going to have about 65,000 spots in this area. We press the Analyze button in order to acquire the best image, and again, you see two images, one of the SLO and the second one of the OCT scan. It is very important that we can select here at the SLO image by scrolling up and down by scrolling the mouse, you can move up and down By scrolling the mouse, you can move up and down in the vertical level, or if you go to the image at the bottom, you can scroll again, and now you move at the horizontal level. So, in this way, you can see all the points of your interest, no matter how far they are from the macula. The maps you see are, again, the map of the ILM to RPE thickness, the pachymetry, and again, the deviation from the normal. You can also see again the absolute numbers of the pachymetry and the deviation from the normal, which here is white, it is not deviating, and of course the volume of the ILM RPE, and again how it deviates from the normal. If you go on the top, again you can have your comments, you can press the print button and see the print layout. You can use the measure, the DICOM, the edit, the history, and the follow-up. But with this scan, you can press the 3D which will show you a 3D image of your retina. It is very important that you can move in all directions, and this three-dimensional vector here will help you to see where exactly you are rotating. So once you have a good view and a good angle, you can always use these spots in order to move in all the directions you want and have a cross-sectional view of the point of interest. And again, you can rotate to all directions. If you go on your right, you can select which layers are going to be visible. All of them, the ILM, IS, OS, RPE. Let me show you, for example, here now we don't have the ILM. And again, here you see the ILM. So you can use all of these features here in order to add or remove any layer you wish. By clicking the exit, you go back to the previous screen, and now you can use the unfast image in order to have frontal images of your retina, which means that again, you can move in all frontal levels. You can go deeper, or you can go at any layer you want in order to have an unfast image of this area. For example, here you are somewhere in the middle of the retina, while now you are getting deeper in the retina, and of course you can go even deeper, and now you see actually some parts of the choroid. If you press exit, that will move you back to the previous screen. And of course, if you want to exit from the exam, you press the exit button. Once we have finished with the macular cube, we can move with the macular cross beam. In this scan, the OCT will acquire high-definition images, 5 horizontally and 5 vertically. What is very important is the fact that you can always change the width in which these images are taken. For example, you can use, as you can see here, the 50 microns width one from the other, or you can change it to 10 microns, as you see here, and this, by using this feature, you can go from 1 micron to 200 microns. Again, you have to be to have the focus appropriate, and once you have a very good quality image, you press the joystick button. The OCT will acquire the images. It will acquire 100 images, as you can see here, and again, you press the Analyze button in order to have the best image. In this screen, you see the SLO again, the raster high-definition lines the OCT has acquired, and of course, you can select the OCT horizontal lines, and by clicking on the image, you can always see here in this window all the information you need. Of course, you can move to the vertical lines, and once you click on an image at the same time at the SLO image, you can see by red which exact image, which exact scan is monitored, and you can watch it, see it at the main window. Now, again, you can have the comment, you can have the print results, as you see here. You can have the measure features, the diacom, the follow-up, and the history features. Once you're done with that, you can press the exit button in order to move back to the main screen. We have finished with the macular crossbeam, and now we move to the glaucoma section, and more specifically to the glaucoma optic disc, which is practically the RNFL. Again, we ask the patient to fixate to the fixation light, and we enter the eye. The fixation light now will be in a slightly different position in order to help the patient fixate properly and have the optic nerve head at the center of our image. We can either use the fixation line in order to move the patient's fixation point, or we can change the cube and center it on the optic nerve head. Once we are ready, we press the joystick in order to acquire the image. You see here the SLO image. There are no faults, there are no noise, which means it's a good quality image. Again, you press the Analyze button in order to have the best images and the result. In this window, you see the SLO image, and of course, you see the circle, the blue circle, which means that these are the points in the 3 mm circle where the RNFL will be measured. You can always move this circle, and you have to take into consideration that this will affect your results. The OCT will automatically find the center of the optic nerve head, but in case you want to change it, you can always go on with this procedure. You can also change the transparency if you want to have a better visualization of the optic nerve head. At the second image, you see the boundaries of the optic nerve head and the cap. These are drawn automatically, and if you go to the image here and you click on the show points, you can see which points exactly were taken in order to acquire the boundary of the optic nerve head. At this image, you can always see where exactly the cross-sectional cutting was made in order to see where you are in terms of this comparative map. Of course, you can see here the segmentation, which is done automatically from the OCT, and if you click on the show segmentation, the blue lines will disappear, And again, if you click on the segmentation lines will be visible again. At the top, on your right, you can see where the RNFL is thicker, and of course, if there are any deficits, even minor deficits, comparing with a normative database. We move now to the measurements. The OCT will acquire the average RNFL thickness, the rim area, the cap area, the average cap-to-disc ratio, and of course, the vertical cap-to-disc ratio, which is very important. You can have sectoral views of different parts of your retina, of your optic nerve head. And so here you can see if there are some deficits which are in a specific area. Here, you would like to follow the isn't rule, which means the RNFL is thicker inferior, superior, neural, and temporal. Finally, you can see the measurements in smaller sectors, as you can see here at this image. You can always compare your results, the results of your patient, with a normative database. And of course, you don't want your patient to cross, your patient's line to cross and enter into the red area or the yellow area, which means that it deviates from the normative database. You can always write a comment. You can press the print button so you see the print layout. You can use the DICOM, the history, the compare, if you want to, and the follow-up button if you want to have a follow-up of your patients with the previous exams. This is very important if you want to see how your patient is doing throughout the time, especially in glaucoma patients. Once you have finished with all of that, you can press the exit button in order to return to the previous screen. Once we have finished with the glaucoma optic disc, we proceed to the glaucoma macular cube. Again, we ask the patient to fixate and we move forward in order to enter the eye and obtain a very good quality image. Now, the fixation light is at the center. Once we have a very good quality, we can press the joystick button in order to acquire the image. As you can see in the SLO image, there are no interruptions, which means we have a good quality image. We press the Analyze button in order to have the best quality images and the results, the measurements. You see here the SLO image, and you see here the actual scannings. You can use your mouse in order to move in different cuttings, in different scans of the entire area, if you want to see more specifically how this area is. And of course, you can add the segmentation, which allows you to see how it segmentates automatically the OCT, the results. At the bottom, you have the cells, the ganglion cells complex thickness in a pseudochromatic map, which means the green is okay, and of course you can compare it with the absolute values. At the second map, you can see how it deviates some points statistically from the normal corresponding values. At the third map, you can see the deviation topography of your patient comparing with the normal results, and at the fourth map, you can have the absolute number of the ganglion cell thickness. Of course, at the last map, you can see how your patient deviates from the normal values. You can always add a comment. You can print the results, and this is how the layout, the printing layout is. You can measure, you can send the data, you can edit some of the images, and if you press to the history button, then you can compare with the previous results of a patient, of this patient. This is the current exam, and this is how it deviates from the previous selected exam. This is very important, especially for glaucoma, because we would like to see how our patient is progressing. We exit and we go back to the previous screen. Of course, you can always follow up the patient if you want to follow up throughout the time or even compare the eyes. Once you are done with that, you press the exit button again in order to go back to the main screen. Once we have finished with the glaucoma and macula exam, we go on with the anterior segment exams. In order to do this, we first have to pull the OCT head back and adjust the refraction button. We have to attach the anterior segment module, and put it in front of the lens. It is a magnetic anterior module, so it permits us to put it very easily in front. Then we will ask the patient to take the position in order to go on with our scans. Once we have set up the patient and have attached the anterior module, then we can proceed with our exam. Again, we ask the patient to see the reflection, and we go on by adjusting the refraction button in order to acquire a better image. Once we have a very good image, we can press the button, the joystick button, in order to acquire the HD line. As you can see here, we have an image of the eye and we have the acquired OCT image. Of course, the OCT has taken a lot of images, and if we press the Analyze button, then we have the best quality image, which you can see here. It is very important that we can, at any time, select to add a comment or print the results. This is the printing layout, and of course, we can always measure any distance. Of course, there are a lot of features. One of them, for example, is to measure a straight line. This is the way we do it, and you can see here the OCT automatically measures the pachymetry of the cornea at this point. If you want to go back, you click here, and then the OCT will ask you if you want to save the changes or not. Let's say we don't want to save them. And this is how we obtain an HD line. It is very useful if you want to see a patient after a LASIK, for example, or if you want to see a patient with opacities, you can locate the depth of the opacities. You can use that in cases of a patient with a transplantation, or even if you want to fit contact lenses. By using this HD line, the OCT will allow you to have all the information you need in order to have all the details you want to proceed with your patient. Once you're done, you can always click on Exit and go back to the previous screen. Again, with this HD line, we can see the angle. We press again the anterior HD line, and once we have the patient, we focus, and then, even when the patient is focusing at the center, you can always move the line at the limbus. And now you can have a very good visualization of the angle. It is important here to see that not only the iris or the angle, but even structures of the angle can be seen. Once we acquire the image by pushing again the button, we have all of these images. We click on the Analyze button in order to acquire the best quality image, and you can see here how good the quality is. You can see a lot of details. It is very important that again you can add a comment, you can print the layout, and this is the printing layout, but again you can measure. And of course it is very important to measure the angle. You can measure the angle by pressing the angle button, and you have just 3 clicks. 1, 2, 3 clicks. With this procedure, you know how the angle measures. You click on the X in order to go back, and of course you can always save these changes or not. This is how we acquire the images from the angle, and if you want to go back to the previous screen, you click on Exit. Once we have finished with the HD line, then we can go on with the corneal 6 radial line. This scan will allow us to have 6 scans, 6 radial lines, and of course, as usual, we have to focus properly with the patient, and once we have a very good quality image, we press the joystick button. You see the scans taken here, and there are 6 scans, and if you press on Analyze button, then you can see the results. You can see here a scan, and of course you can select among the different radials, as you see here and as it is indicated from the red arrow. In each one of them, you can have data at the bottom about the epithelium thickness, absolute numbers, and of course in a pseudochromatic map. These data are very important, especially in cases of refractive surgery or even keratoconus, because they deviate from normal. At the third map here, you can have an overview of the entire thickness of the epithelium at this radial line. At the fourth map, you can have the measurements of the total corneal thickness, and at the next map, you can have the same data in a pseudochromatic map. Of course, at the last one, the last diagram here shows you an overview of all the points and how they measure in terms of pachymetry of the total corneal thickness. You can always add a comment. You can print the results, and this is the print layout. You can again measure as we did before with the angle. So you have the image here, and you can press the straight line. You can set the 2 points you want to measure, and here you have the measure of this specific point. You click on the X in order to go back, and yes, you click yes if you want to save the changes, which means this measurement, or you can click no in order not to save them and go back to the previous screen. Once you have finished with this exam, we press Exit, which will lead us back to the main menu. We have to focus again, and we ask the patient to fixate in front, and then we go on deeper in order to acquire a very good quality image. As you can see here, at some points during the scan, which is a real-time scan, we can see the lens, and we can actually observe any kind of opacities or other details from the lens. Once we are done, we press the joystick button, and we have acquired all the necessary images. If you press the Analyze button, then you're going to have the best quality image, which you see the SLO here from angle to angle, and of course, all the necessary details and informations. You can see that the OCT has automatically drawn some boundaries and some areas. These are very important because the OCT has automatically calculated not only the angle, as you can see here, but also the TISA 500 index, which is an index which is so very important for assessing the angle and predicting the possibility of an angle closure. Again, if you press the print button, you see the printing layout. As always, you can measure or send the data, and once you have finished with this information for both eyes, as you can see here, and at the temporal and nasal side, you can click on the exit button in order to finish. With the same scan, angle to angle, we can also have a very good visualization of the cornea from limbus to limbus. Again, you have to properly take the image, as you can see here. This is real time, of course. You can see, of course, that the whole area is visible. And once you have all of the images, you can press the Analyze button. Do not take into consideration now these indexes. All you have to do is double-click on the image, and then you have a very wide image of the cornea, full thickness wide image of the cornea from limbus to limbus, which allows you to assess not only the central parts of the cornea, but also any pathology that you might see in the periphery. For example, you could see in a DMEC how firmly attached is the transplant in the areas where it ends and attaches in the peripheral cornea. Again, if you go on the top, you can change the contrast of brightness, you can export the image, or you can go back to the previous screen. You can again print by pressing the print button, and you have the same image. You can measure, you can send the data, and once you are done with all of that, you press on exit button in order to go back to the previous screen. Once we have finished with the macula, glaucoma, and anterior segment OCT, we will proceed with the OCT angiography. MOCEAN 4000 uses the OMAC technology, which means optical microangiography algorithm, in order to detect 6 different layers. This is the golden standard for OCT angiography. The deeper you can penetrate with your OCT, the most accurate results you are going to have, and the better and most accurate diagnosis for your patient. Once we have set up our patient again, we press on the OCT macular angiography. Again, we will ask the patient to fixate, and we will move forward in order to enter the eye. You can see here the OCT scan acquired in real time. You can select among the 3 to 3 millimeters area, and if you select this, all the information you're going to have are going to be very detailed. So we are using this mode for very detailed areas in case we want to assess very strictly a pathological area. But we can also go and select the 8 to 12 millimeters area. This one will give us a very wider area, and of course you can use this for a screening as a screening tool in order to have images and angiography of healthy eyes, and you just want to use it for screening purposes. I'm going back to 3 to 3 millimeter area, and now we are going to ask the patient to blink once and then straight ahead fixate to the green light. The eye tracking now is activated to on. We can deactivate the eye tracker, and we can use that in patients that are cooperating very well and healthy patients. we should use the ON tracker when we have to take images of patients which cannot cooperate very well, like patients of older ages or patients with pathologies. Now we have the eye tracker off, and we go on, we ask the patient to blink once and then see the fixation light. We press the button of the joystick in order to acquire the image. This will take less as 7 seconds. We have acquired the image in 7 seconds, and now we see all of the images and the area we have entered. We can see the scans here at the bottom, and we have acquired 1024 scans in these 7 seconds. If you press the Analyze button, you are going to have the results. It will take a few seconds as the OCT has to calculate a lot of different data. This is an OCT angiography, and the OCT has to calculate a lot of algorithms in order to present us this 6 layers angiography. Again, as you see here in the OCT image, you can click on the show lines and see the lines that are used in order to have the segmentation. You can remove or project artifacts, and you can show the flow in each point. Now we can see the unfast SLO image, and if you click, again, you can see a bigger image. You can change the contrast or the transparency or the brightness, and you can export the image. When you click the back button, you go back to the main screen. Now you see here the different layers. You see the avascular, the choriocapillaries. You can also see the depth-coded image, the avascular zone, and of course the choroid image. If you click on the superficial angio OCT, you can now select among the area, the specific spot you want to see the exam. Once you do that, you can go, and by clicking the mouse, you can move deeper in the areas of the retina. This will permit you at the same time have a very detailed but yet very comprehensive view of both the unfast angio OCT and the unfast OCT, which will permit you to combine all of this information in order to acquire the best diagnosis. You can see here how we can go deeper and deeper and deeper and go even to the choroid and see the unfast angio of the choroid and the unfast OCT of this area. This will be very informative and will help you in having all of the details you want in order to achieve your diagnosis. At the bottom, you can also see all the images, the depth-coded, the vitreoretinal image, the superficial layer, the deep layer, the avascular zone, the choriocapillaries, and the choroid zone. You can again move up, as you see here, by scrolling the mouse, and now you see we go more superficial, and now we have a very superficial view of the retina. Using this procedure, you can have at each time the full information you need about the angiography at each specific point, using the data at the same time of the unfast angio and the unfast OCT images. You can always add a comment, and you can press the print button in order to print the current view you have, and of course, you can always select another point and print another view which you might think it's very useful. Once you are done with that, you again press the exit button in order to go back. Here you see again the different layers, and of course you can select which layer you want to see in each point. Here we have chosen to see the deeper layer. Again, if you click, you start from a deeper layer and you can go again all over the same procedure. This image and this procedure will help you and will guide you at all times to know where exactly you go, how deep you go, and which exact point of the retina you are. You click exit and go back to this main image, main panel. Once you are done, you click the exit button and you go back to the main menu. Once we have finished with the OCT macular angiography, we move to optical disc angiography. We press the button, and again, we use the same procedure. We ask the patient to fixate, and then we move forward in order to enter the eye. As we can see here, we can choose among 3 to 3 millimeters scan area or 6 to 6 millimeters area. Here we have chosen the 3 to 3 millimeters area. We will ask the patient to fixate to the light, and of course, if the fixation is not very well centered, we can move the fixation light, and here you will see that the patient automatically will fixate at the point we want to see. Once we have a good quality image, we press the button we ask the patient to blink once and then to fixate again, and then we press the button at the joystick. The OCT acquires the images in few seconds, and we are now ready. It has taken all the images. It will take some time to analyze the data, and we wait until the Analyze button is on. Once it is highlighted, we can press the Analyze button, and here again we can see the OCT SLO image, and of course here 3 different layers of the optic nerve head optic disc angiography: the inner retina, the choriocapillaris, and the choroid vasculature. If we double-click on an image, we can, as always, change the threshold, change the contrast, or if we are okay with that, we can go back to the main panel. We can do that with the 3 different layers, as you can see here. Again, we can add a comment, or we can print our results. This is the print layout. Once, you can always use the edit button if you want to make modifications or draw as we saw before. Once we are done with that, we press the exit button and we go back to the main menu. We have now completed our demonstration in order to show you all the procedures and the special features of this high-resolution OCT, MOCEAN 4000 OCT with VASCAN optical microangiography. It was a pleasure for me to guide you through all of these procedures in order to acquire very high-resolution images with MOCEAN, and I hope this will help you to your everyday practice in order to obtain very accurate diagnosis very quickly and very efficiently. Thank you.